we have a Sustainability Hour standalone session by Rachit Gianchandani and on optimizing the economic impact of outreach programs using statistical analysis, technology, and public health insurance schemes. Rachit is a grade 12 student at Dhirubhai Ambani International School and is an accomplished student leader, athlete, and chess champion who combines academic excellence with strong sense of social responsibility. His pioneering work on optimizing the economic impact of outreach programs has significantly advanced awareness and access to inclusive healthcare, particularly through Ayushman Bharat PMJ and various state public health insurance schemes. By bridging analytical rigor with practical implementation, Rachit demonstrates not only leadership and innovation, but also a deep commitment to promoting equity and driving systemic impact in the society. Ladies and gentlemen, please give a round of applause and welcome on stage Rachit Gianchandani.
Good afternoon, everyone. I hope everybody had a nice lunch. When I was first told that I'm going to be giving the first session after lunch, I was a bit worried because everybody's going to be a bit drowsy. But if you could please power through, I promise I won't take even more than 15 minutes because that's all the time I have. I'm a grade 12 student of Dhirubhai Ambani International School, and I have a vision where I want to bring the access to healthcare to every household and make it something that is just a byproduct of what we are and what we do every single day, spreading awareness about this very important subject. So my journey has been a bit unique because you would assume that somebody who's involved in health insurance and public health policy and interested in the economic impact of healthcare outreach and things like that would be a medicine student. But I'm the absolute opposite. I'm interested in math, economics, statistics. I'm also a bit of a tech guy. But one thing that I was very interested in was what the benefit of these programs will actually be when we quantify it. Because in theory, everybody understands it. But when you quantify something like this, it's a bit different. Before I begin this initial part of my journey, I would just like to thank the AHW organization for giving me this opportunity of sharing my thoughts and ideas with you for the next 15 minutes. Sorry. All right. So this was the first part of my journey, the impact of health screenings and early treatment. So I've had the privilege of working with the RFH outreach program, where the initial program was taking mobile van units and offering free treatment and services, diagnosis, things like that, to different localities, underprivileged localities. So this is just a conclusion of some of my research. I've actually in the process of publishing one of my papers on the economic impact of this same outreach program. So as you can see on the screen, there's some data given. So naturally, nutrition has the highest ROI. You'd ask why? It's because when we look at a disease like malnutrition, the target patient is somebody who has not even started 1/10 of their life. I mean, because when we're treating these people and we're not just saving them now, we're saving the 30, 40, 50 years of their working age where they will contribute to our economy. And under 5 years malnutrition, for example, for every 1 rupees invested, there's a 12 rupees return. Now, when there's a chance like this in business, such a huge return, we all jump at it, but not when it's about our long run future and the future of our country. Same with anemia, 10 rupees for each rupee invested, and diabetes is 6 rupees. So this matters to me a bit on a personal level as well, because in my family, I'm surrounded by many people in the medical profession. So I know, I've heard these diseases. I myself have studied biology till grade 10, and we learn about the human body and the diseases, but it's not just something technical for me. It's a bit personal, because when I would see people like all around us, people helping us, whether it was my chess coach or my football coach in school, or the help that we have in restaurants, the help that we have in or at home, the Uber drivers we sit in, the auto bhaias that we use every single day, we speak to them as if, and we talk to them and we share our problems, but we never tend to look at theirs. And it's so easy for us to just give them a solution. It's not even about getting them enrolled. It's about telling them what it is. So it's personal, because health and the access to healthcare is not just something objective that is treating you. It gives you dignity. It gives you power. It prevents you from missing days of work. It keeps children in school instead of in hospitals, which is not what we want. And as I said before, there's a direct impact on GDP, education outcomes, and workforce strength. As I said, if they're in schools instead of hospitals, they're going to grow up and one day do something for the country that's even more advanced than this. And the process of giving them this initial treatment is the best thing we can do for the future. So this is the next bit is just about insurance, because as we were in the RFH outreach team, when we would be giving them these free treatment or screenings at a very basic level in a mobile van unit, oftentimes we realize that prevention is great, but that's the best alternative. But and we can give minor treatment, but when we need the next step for them to be able to be treated in hospitals. And we all know there is public insurance out there. It's just that the people who don't need it know about it. So so this is a bit of a global picture so that we understand where India stands. So as you can see in countries like the UK, Singapore, Japan, I would just like you to bring your attention to the coverage number. So we're reaching around 100%, and most of the countries are above 90%. Just UAE at 85% and India below that. So why is this? I mean, there's one reason that India, everybody knows, the population is growing very fast and we have to keep track of it. But even countries like USA, which are considered one of the most developed countries, if you look at the key traits, one of them is that it is fragmented, because for a country like India, where the population is so diverse and reaching them is difficult because of the number of people, the different communities, things like that, spreading awareness, it's our job to look at what works in other countries and apply a hybrid model to India. So initially, as I said about we would give the free treatment and screenings in these mobile van units, and we started using those same camps to spread awareness about different public insurance schemes like the Pradhan Mantri Jan Arogya Yojana and the Mahatma Jyoti Rao Phule health insurance scheme, and as well as the partnership between them. And what we realized was that when we're helping them, we see that the first question they ask is not, how can we sign up? They ask, what is this? What is insurance? How long has this gone for? So before we dream of solving this problem, we need to make sure that they understand that there is a solution to the problem. So this is just some statistics regarding penetration in India. So India's health insurance cover, as you saw on the earlier slide, was only 45% compared to the 90 to 100% in UK, Japan, and Germany. The public spend is only 3.5% of the GDP, whereas in the OECD countries, the average is over 10%. So, as I talked about this before, there is a lot of low awareness in India, fragmented systems, and there's a huge rural-urban gap. And because of the number of people that we have, the solution is not just targeting these workshops where we help them register and give them information about the eligibility. And this is where I really thought that I could use my personal skill sets to, make this faster, at least for my community, the one that I was already servicing. So as I previously used my interest in statistics and data to calculate the economic impact of spending 1 rupee in a certain disease, I tried to use my previous experience in designing apps and websites, stuff that in most international schools we get the privilege to learn. So the next idea we had was to make this digital. Now it sounds great, but trust me, it takes a lot of work. So I told you the most vulnerable people are the urban poor, migrants, gig workers, and daily wage earners who have no idea what's going on most of the time. But the good thing is that in India, like this couple that I was speaking to, I think this was my second or third visit to the to the mobile vans where I was joining the outreach team, I realized that although they were not aware of these insurance programs, they had children who, even though they were not of the same ability because of previous insurance schemes like the Pradhan Mantri Kaushal Vikas Yojana, where they are getting free training and education, they have access to basic mobile phones and they know how to use them. So what we thought of was, along with the 2,000 plus beneficiaries that we got through our efforts by going into the community and getting people to register, asking for their documents, eligibility, having government officials there to help them register, this 2,000 could be closer to 20,000 if we could make this available for everyone and make everybody initially know about it. So, most people who are not using this insurance, I'd say only like roughly 10 to 20% would be actually not eligible, while the rest simply don't know about it. So this is the app that we're making, the Arogya Connect app. So its features include the eligibility check for the PMJ and MPMJ program, the GPS hospital locator, which is really important because when we would speak to them, the first or second thing we would say is that the hospital that we have access to is so far, which in times it may be the case, but they wouldn't know that the same scheme is applicable in many public and semi-public hospitals. So a hospital locator for where their current GPS signals their location, access in English, Hindi and Marathi. And the last point is actually, I think, the most important point, because we can give them the awareness, and that itself is challenging enough. But what happens once they use these schemes is also a problem, because at times when I would speak to some people working in the service sector, they would often say that, oh, we don't really, do you have any private insurance options? Many of them, they're not as happy with the public insurance option. But this may stem from maybe one bad experience or two bad experiences, and it has a ripple effect over anybody and everybody that they speak to. So I think this feedback part is very important, and this is where we hope to get some support from the government, because these are the schemes that we're helping popularize and make it a habit of everyday living. So with the claim status tracking. So what does this mean? So when we see a patient put their problem, their location, we give them the hospital, their eligibility criteria, and they finally actually go to the hospital. They take the step and they go in the hospital. Then after they're done, they have a small section where they have full freedom to give a claim or any feedback, and this feedback will be directly linked to the government officials in charge of that community. And with government support, this could really make a huge difference, because in any case, in each hospital there is an Arogya Mitra, which is another support system of the government to help these people figure things out. Because as you see in the picture right at the bottom of the screen, there's a bunch of people waiting for their treatment because they've signed up for the program and they're eligible for the criteria and they're in a public hospital. But you'd also see some support staff. These are the Arogya Mitras who are helping them in this place and try to figure things out. And then after this, whether that Arogya Mitra was there, whether it was helpful, things like that. So then we can also, on a monthly or semi-monthly basis on this app, we would change which hospitals we'd give them ratings, for example. Because ratings do not just have to be about the commercial aspect of it, it can also be about just doing what's right for the people. So this is of course a part of the Reliance Foundation outreach initiative, and the CSR funds the outreach workers, digital platforms, and these awareness campaigns that we're so very thankful for. But as I said before, even a big CSR initiative can only take it to the point where we're spreading awareness and getting people to sign up or their eligibility, and that itself is a big burden. However, it will only be complete when we get help from government bodies to, for example, help track their their experience at these hospitals, for them to give their feedback and make sure that their needs were met. Because personally, seeing this is a very basic thing. It's just that every sector has a duty to contribute to health inclusion, because I would say it's one of the, if this is not a big problem, then what is? Because health, it helps our mental peace, it helps the country's workforce, it helps, it gives you a sense of dignity, as I spoke about earlier, which is actually the most important thing. So, before I conclude, I just would like to remind you guys that accessible healthcare for all is not like a privilege that one should only get with a certain level of financial status, but it's a basic right, because this is our duty as citizens who have the small or a big position where we can make a sense of change. And this change doesn't have to be setting up a huge outreach program. It's just about not even telling the next person who needs it. It's just about telling the next person what the PMJ scheme is, what the Arogya Mitra is, what is the Arogya Connect app, what can we do. Just spreading it through word of mouth. In a world of social media, sending those funny reels is all good and fun, but sending a few reels and snaps on this would also go a long way. Because my work on this field at this in the last 3 or 4 years has been a very, I've put in a lot into it, but it's only a small part in a very large vision where every family is insured, they're empowered. Empowerment is not just about this position or status, it's also about the ability to have control on your life and your health. Because CSR or corporate social responsibility is not just the responsibility of the corporate, but for every individual in this country who's capable of making that change. Thank you very much.